and we're going to get started with David Ash against universal health care. David Ash.
Good morning, Madam Toastmaster, club members, and I don't think we actually have any guests, but I would welcome the guests if we did. I want to start by defining terms, and I also want to thank our Toastmaster and President for defining the term universal health care to kick us off. But I do want to say a little bit more about how I'm defining the term universal health care myself, because I know in the introduction, Joy mentioned reducing the financial burden of health care, and that's going to be part of my focus. But I'm also interested in whether someone recovers or not from whatever illness they have. I think whether they're bankrupt is important, but whether they die is important too. So universal health care, it's something which does not exist in this country, in the US. We have a much more patchwork system. It is something that exists in a number of countries. It exists in Canada, in a number of Western European countries. A lot of these stronger economic powers in the world do have universal health care, but we do not have it here. And that's part of why it's quite controversial. I define it as something where when you go to see a medical provider, no money changes hands. There's usually some single payer who steps in and actually pays the bill. And usually that single payer is some kind of a government entity. Now, why am I qualified to discuss this? Well, it turns out I actually grew up in Canada. The first 22 years of my life were spent in Canada. Then I've been in the US for a number of decades since then. I'm not going to say my exact age, but the point is I have decades of experience in both systems, and I still have relatives in Canada. So I can speak to both systems. And so given experience with both, I'm not going to recommend that the US adopt the Canadian system, at least not, quote, universally, quote. So why do I say that? Well, I'm going to share a few stories about my experiences with both systems. One of them is kind of a sad story. My best friend and my buddy from college, this was in Canada, took his own life back in 1998. This was in Canada, but this happened. So a sad story. He'd suffered from mental health issues for a number of years, and mental health is part of what's in theory covered by the Canadian system. However, a new government came in that was interested in cutbacks, very conservative government, and with only the government responsible for healthcare. If they cut it back, there was no alternative. So at a certain point, my friend had a mental health crisis. He looked for the mental health care that he'd gotten in the past. He didn't get it this time, and he took his own life. He caused a setback. I have an experience myself with regard to my own mental health. When I was attending college in Canada, I was at a college where, in theory, mental health care was something that was supposed to be provided on college, on the campus through the Canadian system. In theory. In practice, it was not available. I was just basically laughed at when I was asked whether I could access this service. A few years later, I moved to the US for grad school. I tried to access exactly the same service there, and I was feeling a bit of a crisis there, and there, no problem. So again, the Canadian system did not work quite the way it was supposed to. Final experience I'm going to share was quite a bit more recent. Since I'm not that young myself, Mother's Day was last weekend. You can imagine that my mother is getting on in years. Now, this was recent. My mother is dealing with some pain, as a lot of people in her age group do have. She tried to seek healthcare through the Canadian system. She was turned away because she was late for her appointment. Not a good thing to do. A month later, she came back and she did get the care she needed. So fortunately, she got a good outcome, but she had to wait a month in pain. At exactly the same time, I, here in the US, sought care from Kaiser. I was late for my appointment. I had a cancer scare. I was late for my appointment. I showed up at Kaiser at 9 a.m. and they said, "Oh, you're here at 9 a.m. for an 8:30 appointment. No problem. We'll see you." Not a big deal at all. So again, the American system worked just a bit better. So those are some of my arguments. Also, I don't have as much personal experience, but I know that I've talked to veterans here in the U.S. who do get their own care through the VA system, and they're not always happy. That's a government-provided system. They're not always happy, and they feel that they've served our country, and they're not happy about that. So again, if you've got this low quality of service and you put it universally, how well would it work out? Now, I do need to, so those are all of my arguments against universal health care. I do need to say I'm not arguing against improving the level of health coverage that we have. I do believe that we have improved a lot in this country. We were at 15.5% uninsured in 2010. We've reduced that almost in half to 7.9% in 2022. A lot of that was due to the passage of the Affordable Care Act. So we're definitely filling in the gaps in our system, and I believe strongly we need to keep filling in those gaps. So when I say that I'm against universal health care, I'm not against doing everything we can to reduce that number of uninsured. 7.9% is still too high. Let's reduce it some more. But I do feel that when you have universal health care and the only provider is the government, there's no economic pressure, there's no capitalist pressure to provide good care in cases where the government care is just not quite there. So I'm all in favor of, I believe strongly it's good that we've reduced the uninsured population in this country through the Affordable Care Act. I believe strongly in continuing to reduce that. But the only thing I'm really arguing against here is I'm arguing against a system where you take private healthcare completely out of the system, because I believe that leads to what I've seen in Canada, where most of the time it works well, but people do fall through the cracks, even when it's quote universal unquote. People do fall through the cracks, and officially that doesn't happen, but unofficially I've seen it happen in Canada too many times. And I know we are doing a lot in this country to improve what we can do. So let's continue on the path we're doing. Let's make affordable healthcare even more available to people, maybe make other programs available, but let's not cut out the role of say the private healthcare system as well. So thank you, and back to you, Madam Toastmaster.
Thank you, David. Excellent presentation against universal health care, offering even examples of how you've seen it in Canada and the United States. That's a unique perspective for some of us, having visited Canada but never having lived there. So our next presentation is going to be our seasoned Toastmaster speaker, Janet Kassalen, and she has been assigned to speak for universal health care. I would like to introduce Janet Kassalen, and Jeff is going to continue to be the timer since we started out that way. And Janet, would you like to speak now for universal health care in the United States? Janet Kassalen, you may unmute and begin.
Thank you, Club, for this opportunity to debate for universal health care. And it's even great that we're debating for and against universal health care, because we need to do this and to get this information out there and work on solutions that we can incorporate to work towards universal health care, and to quickly redefine universal health care. At the simplest, the universal health care definition is any action that a government can take to provide health care to as many people as possible. And it's interesting to note that in the United States, our life expectancy is less than other comparable countries. And let's see, other countries have universal insurance coverage with a minimum cost barriers, a strong commitment to community-based health care, few administration burdens that can hinder access to care, and well-resourced social services that can support healthier populations and reduce stress in the care delivery system. So the United States has decreased life expectancy compared to other countries. And there are a certain number of people that don't have any insurance at all. So a universal health care would be a safety net. Some people can't afford insurance and they end up on either losing their jobs and on bankruptcy, trying to pay for health care. They lose their jobs because they're sick. So hopefully in a universal health care system, we would have some sort of sick leave and disability factor that would help people. And I know pharmaceutical companies have lobbied a lot against universal health care. And I can sympathize with them in the fact that they have to do a lot of research to come up with drugs, research and testing, and then try to get back the money that they spent developing the drugs in a certain amount of time before the generic drugs are formed. So hopefully in a universal healthcare system, we would work out some sort of a solution with the pharmaceutical companies so that they would not have to increase their prices so much. And universal healthcare would have less cost because it'd be centralized administration. You know, I go to a family doctor who he has to oversee the administrative area of his operation, and hopefully, a universal healthcare system, the physicians would focus mostly just on caring for the patient. And I know that Americans value freedom and independence and freedom of choice. Well, I think it's important to know that life, liberty, and happiness, we wouldn't have that if we didn't have health. And a lot of the articles I read talked about making health a priority, just in the population, in politics, in companies. We could do a lot more to help the health of the world. I mean, I was just looking at McDonald's. There's like over 600 McDonald's in Ohio, and it's not the best thing to stop at a McDonald's on your way home from your stressful job to get something to eat all the time. And so the COVID incident helped show how the private sector couldn't take care of the needs of people. The more people die because there wasn't a universal health care system set up. And in Canada, I know there's long wait lines for everything. But they are trying to remedy that and focus on feeling that people have a place to go for their primary care, they have a home to go. So we do need to focus on making sure people get the care that they need in a timely fashion. So I appreciate my opponent's information that he shared. I am glad that he is for increasing health in the United States. We are just debating on different ways of doing it. Thank you.
Thank you. Thank you, Janet. Two great presentations. So I'd like the timer to put a minute on the clock. So while we are thinking about the evaluations of the debaters, I would like to see more questions in the chat for us to ask the for and the against presenters. And we can ask the same question. And I only have a few questions so far. So please add your question directly to Joy Harris. So when you look in the chat, most likely it comes up to the word everyone, and there's a little down arrow where you can choose just to send a chat to one person. So if you could send your questions to me, then I'll be quiet so we can have our moment of silence for making notes and sending those, and then I'll get started with some questions.
That is 1 minute, Madam Toastmaster.
All right. So I am still accepting questions, and there is plenty of time for questions and open discussion. I'll go ahead and get started on a question, and I have a question. We'll ask Janet.
Real quick, the timing on this, 60 seconds green, 75 seconds yellow, 90 seconds red. Go ahead, Joy, I'm sorry.
No, that's very good. Thank you for reminding us of the timing. So it is quick. We're not looking for 3-minute answers. It is as Jeff just defined it. So please watch for the color system. So our first question is, and so Janet, would you take this question? Do you feel that universal health care would stagnate innovation at pharmaceutical companies?
Okay, the question is, I guess I'm off mute then. The question is, do I think that universal health care would stagnate pharmaceutical companies' innovation? And like I alluded in my speech, I think that there should be a system of working together with the pharmaceutical companies so that they don't have to try to reimburse themselves for all their testing and research costs all at once. There should be some more restrictions on when generic drugs can come out. And that way, it would encourage the companies that do have to do the research to do more research.
All right. Thank you, Janet. So David, will offer you an opportunity to speak on the same question. Do you feel that universal health care would stagnate innovation at pharmaceutical companies?
Thank you, Madam Toastmaster. Again, I will draw a little bit on my experience both in both of the two northerly countries in America, in that I mentioned in my speech that I came to the U.S. for grad school, and a lot of what I was coming to study in particular was artificial intelligence in medicine. And I was interested in the AI, but I was very interested in the medical. side of that as well. And so I don't necessarily have experience with pharmaceutical companies. I do feel that innovation in medical research is something that is a bit stronger in the US. And again, that's due to the profit motive that I don't feel you can completely take out. You can definitely do everything you can to increase healthcare coverage and increase the percentage of people who are covered. But I think you do need a little bit of a capitalist motivation. So I actually do fear that it would result if you completely took private insurance out of things and nationalized pharmaceutical companies or whatever, or regulated them even more heavily. I mean, they already are pretty heavily regulated, but if you regulated them even more, yeah, I do think it would reduce innovation. Because I do feel strongly that innovation is one strength. I mean, Canada has a lot of strengths, but innovation is America's greatest strength. And I do think capitalism is a big factor in that. So yes, I do think that fear exists, even though I did not talk about it in my speech. Thank you.
Thank you, David. Perfect. Perfect. Thank you for both of our speakers to answer our first question. I'd like to go on to the second question. And this time we'll have David answer first. And then as he had taken a position of against universal health care. And then we'll have Janet speak on the question. And the question that came in the chat is, do we know why today's healthcare cost is so unaffordable? It's just outrageous. David?
Thank you for that question. I have not been approaching this all that much from a perspective of the actual cost. In my speech and how I've been approaching it, I've been thinking more of, okay, what kind of an actual medical outcome does one get? I know the cost is a really big is a really big issue. The only thing that I would say about that is that I think it is very it is fairly easy for most people in this country, and this may be controversial, but I'm going to say that I think it is fairly easy to make money. I don't think that's compared to a lot of places, including a lot of other capitalist countries. I think we have an economy here where there's a lot of opportunity to make money. So there's a lot of money floating around in this country, and a lot of opportunity to make money. That does tend to drive up the cost of the healthcare system. So given I did not focus all that much on the cost of healthcare in my speech, but definitely I'd want to see some way of that is a factor that we also should be looking at. And I would look at, are there ways that maybe the I don't know, the regulation level of regulation is very high. I think that sometimes actually drives up healthcare because it's there's so much fear of lawsuits, so much fear of falling afoul of regulation that just increases the cost. So I do think that's a negative, and I do think it's something we need to look at. Like I said, I think it's easy to make money, and therefore that drives up the cost. Those are my thoughts.
Thank you, David. So now we will hear from Janet, who took the position of for healthcare, but this is a question from the audience, and it says, why do we know why healthcare cost is so outrageous and why it's so unaffordable for so many people? Janet?
Thank you, audience, for the question of why healthcare costs in the United States is so outrageous. And I can't remember the rest of the question, like what we can do about it. I did research an article from the Organization for Economic Cooperation and Development. It said that higher prices are the primary reason why U.S. spends more on healthcare than any other country. So the higher prices of things, and I know people in the past have talked about high drug costs and high insurance costs, and when you have the private insurances, you have increased marketing costs, and also the insurance companies have to come up with all kind of different ways to offset the manufacturer's marketing power, such as rebates. So they spend time with their advertisement and other things that universal healthcare wouldn't have to do.
Thank you. Thank you. Excellent. All right. We're still accepting questions in the chat, and you can send your question directly to Joy Harris. I have another question, and this time, Janet, you'll go first. We're rotating back and forth here. So this is a little bit about, can you speak about the expense to an individual of a self-pay or a company pay system?
Let's see. I do know that Canada has the self-pay system. I believe it. Oh, no, they have the single pay system, single payer system. So a self-pay, extensively self-pay system would be like covering anything that you would have to pay for. And you would hopefully hope that you didn't have a lot of medical problems, but if you did have some medical problems that needed real extensive care, I think self-care pay would be a big hardship on you, and probably end up in bankruptcy and possibly lose your home and everything. So the universal health care system would hopefully avoid the high cost of the problems with the high cost of self-pay.
All right. Thank you, Janet. Thank you very much. Now we'll give David an opportunity to talk about, can you speak about the expense to an individual of a self-pay or a company pay system?
Thank you, Madam Toastmaster. I believe that the main difference between self-care, like a self-pay and a company pay system, and by the way, neither of these are really universal healthcare. So we're not really talking all that much about universal healthcare in answering this question, because they're both options that both currently exist in the US, even though we don't have universal healthcare. So I'm no longer talking all that much about universal healthcare, but I'll answer the question, which is that to me, the biggest difference is that the premium is, if the employer is paying, the premium is covered by the employer. Whereas if it's self-care, if it's self-pay, then you pay the premium up front. There are usually out-of-pocket expenses, whether it's a self-pay plan or an employer pay plan. And usually, at least I've never seen an employer pay plan, and I've been on a bunch of them over the years where the employer pays all the costs even when you seek healthcare. In other words, the employer pays the premium, that gets you healthcare. You have the card, you go in and you're going to get healthcare, but you're still going to get a bill after that. And I think the bill is comparable to what you're going to get when it's self-pay, but when it's self-pay, you do have to have that discipline of actually paying the premiums yourself, and those premiums can be expensive. So you definitely have to budget for the premium, but that's the big difference. And I think one of the reasons why why some people are uninsured is they really don't want to pay that premium. They think they're not going to get sick, and so they're not paying that premium. So yeah, the premiums are pretty expensive, and that's the main difference.
Great, thank you.
And Janet, we are out of time for the Q&A. So I'm sorry, Joy, not this.
Thank you. And we're out of questions. I had a question, but we'll put that on the back burner. This has been so good to hear about universal health care for and against and experiences with that. When you are ready, at any point when you are ready to vote for the best debater, you can select Joy Harris and put J for Janet or spell out Janet, D for David. We'll know that's David Ash to vote. And at the end, we'll announce who really was the winner of our debate today. All right. I am going to say I would like to turn it over to Veronica Sanford, who is our general evaluator for today. Veronica, general evaluator.
Hi, everyone. All right, so the round robin, the evaluation today is going to be a round robin, which means that everybody but Janet and David Ash can give a comment on what they thought about the debate speeches. Excuse me. I will first ask Jeff if he would be so kind to give a brief evaluation for both David and Janet, if you so fit, or just say pass.
Sure, yeah. Wow. I was kind of blown away by how good both of these individuals were. Just give me 1 second here. I'm doing too many things. Both David and Janet, I think, really gave compelling reasons for and against. The thing that stood out for me, David used stories and experience. Janet tended to use facts. And so for me, the stories and experience almost always went out. And I'm a fact person. I love facts and details, but the stories just tug at your heart. And I thought that was really effective, more effective than the facts. The delivery part, I also thought, I think both David in particular was just using eye contact, even on the responses when you're having to think impromptu. I thought that was really effective. And then both of them had just these killer phrases that I thought really stood out. Janet said, "Health is a priority." So that I thought that was a really powerful statement. David said, "Innovation is America's greatest strength." I think that was in his response. Both of those were really great lines. That's all I have. Back to you, Madam General Evaluator.
Thank you so much, Jeff. I will also add that I really liked Janet's use of the term life, liberty, and pursuit of happiness. If you don't have health, you don't have those. And I do think that if you're sick, it's really, really hard to also afford a healthcare insurance bill. I have heard of insurance bills as high as $2,000 a month, which for somebody who is on a minimum wage, that's just impossible. And of course, they very likely have kids or pre-existing conditions, which doesn't mean that they're sinners or immoral or anything else like that. It just means that they have a higher health insurance bill, which can be very prohibitive. I would like Dave Delahanty to please give the next evaluation for both.
Yeah, I kind of agree with Jeff there that about the stories and stuff. I think that really is touching. The facts are great, so we also need the facts and the stories to make it complete. Because even from my own personal experience with healthcare costs, this goes back 30 some years ago, dealing with our daughter. I already had got a glimpse of what our healthcare was going to be like when I got to the age I am right now. And with her condition, that when we had to take her to speech therapy and physical therapy, at the end of the month, after the insurance lapsed out and wouldn't pay anymore, that left us with $200 a month left to live on after we paid our housing expense. So financially, that is a great financial burden. And even on the healthcare cost, as you mentioned, that the employer that I had was right now, those employees, when you total their premium and their out of pocket, is 45% of their income. So healthcare in our country is outrageous. And I believe it's part of that is because of corporate greed. You can't have these people making the kind of money they're making. And even the hospitals, I was at a hospital and I got on their website, and there I got onto their link for their leadership. And I scrolled through the leadership. None of them are doctors. They're all business people. And business people are telling our doctors how to take care of us. You have to remember when we were kids, when we went to the doctor, when you walked in the doctor's office, on the placard outside his office or their office was Dr. John Smith. Today, when you go to the doctor, when you walk in, the first thing you see is the corporation, and the doctors are no more than employees, and they're to do what they are told by the management. And I believe that is what a lot of problems are with the healthcare cost.
Thank you, Dave.
Okay.
I will stop you. I understand the passion. I really do. And we'll have you give a speech next time. The time after that on this whole topic, because I think you're very great. Really good stories. I do believe that, oh, Joy, please, if you would mind, round robin evaluation.
All right, great. Thank you. Well, as a fact lover, I was really impressed by the amount of homework that both of them did. You know, Janet referred to articles that she read and ways that she researched, and they had information and were able to answer some of those questions with, if they hadn't been thinking about it since they knew they were going to be debating, maybe they would not have had an opinion or been able to answer our questions. But both of them, you could tell David did his research and he came to us with some facts and also with some stories. So I thought we had a really good mix of hearing statistics as well as actual practical application of how it works in other countries. And I learned a lot. And I also felt like both of them were dedicated to their position. You know, we were asked to participate in a debate and we were told, here's the topic and here's you are for or you are against. And they did their role very well. So I really enjoyed both of the presentations today about universal health care. So back to you, Veronica Sanford, for the evaluation portion.
Thank you. Thank you so much. Now we do have 3 more minutes. If I'm actually 2 more minutes. With timer, would you mind putting that on the clock? Joe, do you have any comments? Even if you didn't get a chance to hear the debate, do you have any stories or thoughts about universal healthcare? I know it always takes a minute to unmute ourselves. I can see you're talking, but I can't hear you. And we're all holding our breath. Does anybody have any? Oh yeah, I have a joke about why did the skeleton have to quit medical school? Because his heart just wasn't in it anymore.
I love it.
Here's another one. He didn't have the guts to operate. There's one final one. More people I talk to, the more people give up on. Okay, Joe, we ran out of time. Oh, no. You were indicating. Okay, Jeff, how much more time does he have now? We have only, let's give him a minute and a half, 90 seconds, if you don't mind. Okay, Joe.
So I'm in now. Sorry, anyway, yeah, sorry I missed so I saw the last part of the debate. I was thinking of it earlier, and then I forgot about it and went on a couple of errands, and I rushed home, and then I couldn't figure out how to get back in. And only after the fact did I see you sent a link to my phone, which I'm still trying to figure out how to use, this new Pixel phone. So anyway, great to see you all. Sorry I was late.
Okay, thank you so much, Joe. All right, I'm going to turn it over now to the timer report. And if you would be so kind, Jeff, you have 3 minutes. I sort of doubt that you'll need that.
No, I botched up the timing on David. I missed the green light entirely, so apologies on that, David. But David, you were at 6:45. Janet was right at 7 minutes. I didn't write down the times for the responses, but they tended to be all of them were under or right at 90 seconds. So congratulations on that. Timing was all good. Back to you, Madam Evaluator.
Great, thank you. I would like to ask first David and then Janet, what's your experience been of this debate? How do you feel about how the meeting went? David? Oh, and could we give him a minute and a half, please? Thank you.
Thank you, Madam General Evaluator. Yeah, it's definitely it is a challenging topic to talk about. It's given me an opportunity to tell a little bit more in the way of stories. So I've learned that, and I know that I was given feedback at a speech competition a little while ago. I was speaking on a very dry topic, mathematics, and I probably should have introduced more personal stories into that. And I didn't. And there actually are some, it's a very dry topic, but there are some personal stories I could have told then. So I think that's the biggest takeaway that I've learned. That I do get the sense that telling some stories has been effective today. And maybe I need to do that with other topics. I mean, this topic, honestly, I could have argued either side because I see advantages, honestly, to both sides. But I could have told stories on either side too. And what I learned today was the benefit of those stories, perhaps more so. That's really been the biggest takeaway for me, is learning, perhaps connecting a bit more with the stories. Thank you.
Thank you, David. And I will say that I did get an opportunity to go hear the worldwide winners give a training on speaking. And they said that stories sell. And I believe they said facts fall, but I made that part up from my memory. So, all right, Janet, sorry to lead in with that. That was no criticism on your side. I just know that there was a lot going on in that on that topic. So, Janet, what did you think about how this meeting went, how debates go in general? And would you like us to do it again? Over to you.
Well, I like the opportunity to focus on the topic and learn about it. I wouldn't have learned as in depth about it if I hadn't been signed up to do a debate, and it was a chance for me to voice my opinion, which I don't do very often. So that was another good thing, and it was good to hear David's side of it, and thought it was a good meeting.
Thank you so much. Thank you. All right. Well, we do have, at least on the clock, 3 more minutes for the general evaluator. And I will say that overall, I did help coordinate a debate many years ago before we changed Toastmasters over to the Pathways program. And the debate was for and against fracking. And I think, if I remember correctly, it was with TV Toastmasters, and it was probably a good 2 hours. And we had 3 people on one side and 3 people on the other. And the 3 people each presented, a point of view. And it went back and forth. And we also had time to respond to the debater, the other person on the other side, so we could counter their argument. So it was a fascinating process. The fact that, quote unquote, my side won, only really shaded it in, and I won't tell you which side, doesn't really matter. It was fun. was different and it was fun. And that's one thing that TV Toastmasters does. We do things differently sometimes to just break it up. And it's not the same people always giving the same speech, or, same speech, different title. But it is really a lot of fun. And so I encourage anybody who's seeing this on YouTube to really check us out. Every time it's a little bit different, and you'd always get a chance to say something if you did join us even for a little bit. So now I would like to give we got the information from the timer, and now I'd like to turn it over to our Toastmaster.
Thank you, Veronica. Thank you for everyone who attended today. And thank you for those who voted. The voting time is just about up. If you had a vote, you can send it directly to Joy Harris. But what we have as the votes so far is people congratulating both sides. So that is so much honor among Toastmaster members and Toastmaster friends. And I guess now I consider us all friends. So congratulations to everyone. The winner of our debate today is David Ash. So congratulations, David, for being the winner of the great debate of universal health care. And congratulations, Janet, for speaking to us today on universal health care. Thank you. Thank you so much. I would like to say, do we have time? Let's see. David, would you like to give an acceptance speech? An acceptance speech to thank the voters and to say what you will do with the honor of winning the debate and how you can move forward from earning that title. Just a minute and a half for your acceptance speech.
Thank you, Madam President. So thank you, everyone, for the opportunity to participate in this debate, also for the feedback that was provided, and also for everyone who voted. Of course, the votes are anonymous. I don't know who I'm thanking and not, but I also definitely want to thank Janet for participating as well. And I definitely learned things from Janet's side of the conversation. I would say the biggest takeaway is the feedback with regard to the stories. I do feel that was effective, and is something that I'm going to learn from in other speeches going forward, and perhaps other debates, that not to be quite as dry as maybe I've been in the past. So that's really the main takeaway that I draw from this. I also do think that the opportunity to answer questions, so not just the initial speeches, but the opportunity to answer questions was also, I think, a good feature of the whole debate, because it forced us to think a little bit more and not just come with a prepared speech, but then, okay, what is the reaction to that going to be? It gives a little bit more of a clue as to how the audience is reacting to the speech when you get questions, and that makes it a bit more interactive. So I enjoyed that part of it as well. I learned from that as well. So I learned from everyone. I learned from the audience members, and I also learned from Janet as well. So thank you, and back to you, Madam President.
Thank you. Thank you, David, for giving us an impromptu acceptance speech. And I like the opportunity for us to, even during table topics, it is a good idea to, let's just vote for who did the best today in impromptu speaking. And as I mentioned, even though the format was completely different today, we had an opportunity for prepared presentations as well as impromptu speaking, and as well as giving evaluations or feed forward. And I appreciated that David said he was going to use the fact that storytelling was brought up so many times today going forward. I'm pretty sure David evaluated one of my speeches, and it was dry as it wasn't even a dry subject, but I had no personal stories. And I did learn from his feed forward that he gave me about putting a little more of myself into my speeches. And Today, we had both of our speakers speak passionately about the research they did and what they learned, and a little bit more about universal health care. All right. Well, it is about time to wrap up today. And I would just like to thank everyone for coming. You can join us on the first Thursday of the month at 6 p.m. And you can join us on the third Saturday of every month at 10 a.m. And please watch your email and any other announcements for any straying from that schedule. Occasionally, we have to postpone a certain meeting related to the 4th of July or related to Toastmaster organization meetings, which sometimes are on Saturdays, or contests. We might alter that schedule, but you can look for us, Cincinnati TV Toastmasters. Look for us online. Look for us on YouTube, because we are 100% virtual. We're accepting members from all over the country and indeed all over the world. And there are leadership opportunities in our club for people to come to our club and get involved in the running of the club and the public relations, the membership, the education department. There's so many opportunities here. Did you want to say something, Veronica?
Yeah, absolutely. So I just wanted to say that in case you see this in time, the first Thursday in June, that would be at 6 p.m. Eastern time, we will be having the district winner come and give us a speech. And she really does do great stories. Her name is Suzanne Skrobach. Really looking forward to that. And I will say that if you in corporate America or are an entrepreneur, these roles that you would take on if you wanted to, completely voluntary, roles that we'd take on in Toastmasters give great training with respect to corresponding roles in corporate America. Thank you. Back to you.
Good points. Good points. All right. If there are no other comments, again, I would like to say that we started on time. We're going to finish on time. And I appreciate everybody for joining. I will be watching this on YouTube, and I'll be pressing the like button. We have 300 people that are signed up to watch our YouTube videos. So please indicate that you've watched it just by pressing the like button. We like that. All right. Thank you, everyone, for joining. I'll see you all in June.